Greetings, my fellow nurse brothers and nurse sisters. Welcome to the nursing affiliated channel. Today, I want to just kind of throw out and let you guys know, don't forget to check out NurSepiration.com. It's my website. We're going to be discussing everything from like nursing, different questions you guys want to talk about, and also travel nursing and questions that you may have. It's all on there. There's a question board too, guys. And it's kind of a quick update on what's going on in my personal life and also for everyone else that's involved, especially for the mission trip, guys. Don't forget to check that out. So the $1 million question of the week comes from Eo da Calisi. I don't know if I said it right, but she says, can you please give me some tips on how to transition into a new floor unit? Ooh, I like that. Also, how should we present ourselves as a new kid? In order to better integrate ourselves to the team, most seasoned nurses can be hard to deal with. So that's a great question because anybody and everyone will start on a new floor, new unit, or if you're a traveler or going on as a floater, anyone will go through this. And so I have 5 tips on how to kind of just deal with the new environment, new surroundings. If you're going to go to a new area, especially for a unit or whatever floor you're going to be working on, I have the 5 tips. Number 1 is definitely going to be on time. If you are early, you're on time, guys. So be there 15-20 minutes early before you clock in. Kind of just touch bases on the surroundings, your environment, where the floors at, what floors, and what rooms. Also know where the computers are going to be at, especially when you do your training and your assessments. You got to be on point. Find out where the Pixis is, all that good stuff, guys. So just kind of just touch bases of your surroundings. Don't be a weirdo and kind of just like go into each room. You're going to be breaking a lot of HIPAA violations doing that because they're not going to be your patients. But just kind of go around and figure out your surroundings. So like I said, be there on time. Number 2, guys, when you get report, be short, precise. Be very into what's going on with the patient, SBAR, situation, background, assessment, recommendation. So when you do get the report, find out why they're here. What's the assessment? What's the plan of care? If they're on drips, find out what the protocol or what the doctor's orders are. If they're titratable, what's the plan of care? We're going to extubate. Did they have a cabbage? What's going on with the chest tubes? Figure out and go to the head to toe. Pulmonary, work your way down to cardiac, down to if they're down to musculoskeletal, vascular, to their kidney function. What's going on? What's your Foley output? Everything that you're going to go from head to toe and find out what the care plan is. So you definitely want to get the patient in and out. Don't spend the day figuring out a 40-minute report. We do not have time for that. Concise and precise, guys. So the number 3 thing that you're going to do as a traveler or a new nurse or going onto a floor, you got to be organized. Bring your stuff that's needed, your paper, your pen, and also get all in with Epic, whatever computer program you're using at your hospital. Get in line with Pixis if you're using that. Make sure all your codes and everything works. We have this issue with everyone that comes on the floor. That's the first thing you guys should do. Make sure all your codes and your passwords and everything work for your patient care. Because when stuff hits the fan, trust, you're going to need all that to get your medications and your assessments in on Epic or whatever computer program you may be using, guys. Number 4, I definitely say food. It's important. And hydrate, guys. Stay nourished. Drink some coffee. That's very important. And also stay hydrated. Drink some water every hour or so. I always drink a cup of water every hour. Drink coffee every 30 minutes. I know. I have a guilty pleasure to that. And I bring granola bars. I have to stay hungry because if not, I get what's called hangry. And you guys know what that means. Hungry and angry at the same time. So we all know how that is, and it's on another level. We do not have time for that because patients come first, guys. And 5th, most important one, and this is the most important one because I make it as the last one, be presentable, guys. Make sure that when you ask questions, it's not what you say, it's how you say it. So you present yourselves, make sure you're very polite, and attitude is everything. So, kindly ask, can I ask you for a favor? Can you show me where this is at? Or I know you're busy, but can I utilize your time for 2 seconds? It's how you ask, guys, and that's very important when you're working. Now, there's some nurses that have their old set certain ways, but it's okay. So you have to ask everyone around that may help you. Don't forget to ask questions, guys. That's the most important thing. So hopefully those 5 tips help. Number 1, be on time. Number 2, give a report short, concise, and precise. What's the care plan for the patient? Number 3, be organized. Get all the stuff that you need and make sure your codes, your passwords, everything work. Your pen, your paper, everything that's needed for the nursing report. Bring your stethoscope, guys. Number 4, food. You do not want to get hangry. Bring some snacks, drink some coffee, stay hydrated, guys, and make sure you utilize the bathroom because we all forget to use our own bathroom for ourselves. Number 5, be presentable, guys. Be professional, make sure you're up to par, and definitely ask questions. Remember, it's how you say it, not what you say, guys. My fellow nurse brothers and nurse sisters, 5 tips, utilize that for all my new grads. Don't forget, NursePeration.com, check out that website. Number 2, thanks everybody for donating for the mission trip. The link is in the bio in my Instagram, guys. My fellow nurse brothers and nurse sisters, any questions, shoot them on the bottom. I love you guys, and stay on tune. I got some coming up pretty soon, guys. You guys will be on the lookout. Love you guys. Peace.